One of the things that you said before, there's one particular hospital trust that's nearly got 1,000 staff responding. A priority question that's come through is, how do you encourage healthcare staff to be more engaged in patient experience? Because the attitude is, well, that's the patient experience department. My job is to get on, with helping patients or managing the staff. Patient experience sits over there. So how do you encourage staff to, where patient experience is everybody's business? And I guess by patient experience, I mean, if patients are before you, clinicians would say, I am engaging with the patient's experience. I'm fixing their experience of illness. But in terms of patient experience about the feedback component, how do you engage, increase sort of the staff engagement around that? In Australia, I think that's a bit of an issue. I think we have specialised patient sort of feedback, and that's not a criticism. I just think that it's just our history. That's what we've done, and I suspect it happened in Scotland and England as well. I would imagine that's pretty much the same. But it sounds like when you said you had a hospital with 1,000 responders, to me that's enormous. I mean, I don't think that happened here. I hope it does.
Yes. It took them a while to get there. Like we were saying, it doesn't happen overnight. I mean, I think that clinicians do care, exactly as you say, very much about the experiences of patients.
Yeah.
What they might care less about is the sort of organizational structures that are put in place to, if you like, monitor, manage, improve what we like to call patient experience, with capital P, capital E, that sort of, I think in a sense, we have corporatized it a bit in a way that means that clinicians can say, well, that's someone else's job to do that. That's not what I do. I do the clinical bit, somebody else does the patient experience bit. That doesn't mean that clinicians no longer care about the experiences that people are actually having. It's just that they may not care about the organizational mechanisms so much.
Yeah.
So that's part of it. But having said that, there is definitely, there is research showing that clinicians, doctors specifically, are quite ambivalent about patient feedback. They really have mixed feelings about it. In the sense that they'll say, well, it's really important that we listen to what patients are saying, and patients can tell us how we're doing things well or badly. But at the same time, they don't always know what they're talking about, and sometimes they give us feedback because they're trying to sort of jump the queue, or they're trying to sort of cause trouble or whatever it might be. So there's a paper by Joe Farrington and others around this ambivalence, and this ambivalence isn't just to online feedback or narrative feedback, it's also to survey feedback. So that ambivalence exists however you do the feedback. And so I think there is a sort of, medical and nursing cultures over the last 200 years have not necessarily prioritized this idea of feedback and learning. It's not, and that's not going to change quickly. I mean, it's not built into professional DNA to sit down with patients and say, how did I do? What could we do better? That hasn't been part of professional cultures traditionally. Some clinicians may always have done that, but most won't have. And so it is a gradual cultural shift. It's not just an individual shift. It's a cultural shift we need to see, so that people just take it for granted that, of course, we ask people what their experiences are like. And of course, we use that to improve our service. That's important.